Kim Linder, your host of the Caregiver Hour radio show. It's on every Monday from 11 a.m. to 12 noon Eastern Standard Time on 1250 AM WHNZ. Well, every week we bring you wonderful information, resources, and guidance for caregivers, the professional and family caregiver. And this week is going to be phenomenal. It'll be enlightening and empowering as we introduce two people from St. Joseph's Hospital. And that's where we are right now, taping this video. We have Tammy Dragel, who is the Healing Touch Coordinator. And then we have Kristensen, who is a Healing Touch, who is a radiation therapist and a Healing Touch practitioner. The two of them are going to make a demonstration right here for you to see that when you come to St. Joseph's Hospital, you have the option of have Healing Touch make a difference in your life.
I'm Tammy Dragel, and I'm a Healing Touch practitioner at St. Joseph's Hospital. And what I would like to do is demonstrate a few Healing Touch techniques on Kathy Kristensen, who is also an employee at the hospital. She is a radiation therapist, as Kim said, and she's also a Healing Touch practitioner and uses Healing Touch in her work in her department. So I'd like Kathy to lie down as I explain a little bit about what Healing Touch is. Healing Touch is an energy-based approach to health and wellness that uses contact touch as well as non-contact touch to help restore harmony and balance in the human energy system. Healing Touch is designed to help facilitate a relaxing response in the patient. And the basic concept is when your body and your mind are at their most relaxed that they can be in, your body can ignite your healing response, your own healing response. And this is done through three basic ingredients: a centered heart, compassionate intention for the person you're working with, and gentle touch along energy points in the body. So I'm just going to demonstrate a little bit on Kathy here, how relaxing this can be. So the first thing we want to do is center ourselves through a quiet moment. We want to attune to the energy of the client by placing our hands and just connecting. And this specific technique is designed to help clear the mind of any clutter, of any chatter, through gentle touch along points on the head. Healing Touch can be used for a variety of conditions, from any system in the body, from GI to circulatory to lung conditions. Anytime the person can relax and tune into their own healing response, it's helpful to the patient. Some of the responses we get from the patients are they've never felt so relaxed, that their pain has gone down, that they feel a sense of well-being about them after a Healing Touch session, that their anxiety has come down, nausea has reduced. And the nice thing about this program is that not only do we treat patients in the hospital, but we also cater to patients' family members or those who are giving care to others in the hospital. Sometimes we recognize that these people, these caregivers, are stressed, they're in need of respite, they're in need of some quiet time, and so many times all they need is a little permission and a little offer to come, get quiet, have some hands-on touch, and it's amazing that they feel refreshed, they feel that their stress has melted down a little bit, and it's a very good way for the caregiver to go ahead and keep giving from a full cup rather than from an empty cup. Healing Touch promotes self-care, so that's another way that Healing Touch is helpful and beneficial to caregivers. It's going to promote and empower you to care for yourself so that you can keep giving care to your loved one. So now that I've shown you some of the techniques of healing touch that use contact, I'd like to show you what it looks like to use non-contact techniques. So Kathy, I'm going to have you lay down again. And remembering that healing touch is an energy-based therapy, and what that really means is that it's based on the concept that we have energy running through our body, but we also have energy radiating out from our body, and because that energy is just an extension of ourselves, it can be cleared and balanced and influence the body itself, even though we're not physically touching the body. So normally we would do an energy assessment on the body by placing our hands just a few inches above and running through and over the body, feeling for any differences or any changes in the energy. For example, if a patient was having pain in the abdominal area, what we might feel is a change in energy. It could be a fullness, it could be a tingling, it could be some heat. But from here to here, you would feel a distinct change. So we would begin by just sort of running our hands and clearing the area where we feel the change. And I've actually had patients tell me that they've opened their eyes and they've said that they felt like I was rubbing their tummy. So that's an example of how energy that radiates out from us can actually be felt in the body, even though we're not physically touching. So this is a magnetic pass. It's called Hands in Motion, and we're just going into the area of discomfort and smoothing and clearing the energy field of the body. We would often reassess to feel if what we felt before is gone or changed in any way. And when it's felt that the area has been balanced or shifted, sometimes that shift comes in a relaxation response from the patient. We notice their breathing is easier, we notice their eyes are relaxed, we notice their face is relaxed, or we sense a change in the energy field at the spot we're working, then we can complete that technique. So to learn more about healing touch and how it can benefit you as a caregiver, please tune in to the Caregiver Hour on May 9th.